Right. We know that just by the proof, if you had your wisdom teeth removed, that your jaws are too small. Otherwise, you'd have room for the wisdom teeth. Welcome to the Alfi Podcast. This is your host, Dr. David Alfi, where every week we deep dive into how you can be the best version of yourself, tap into the ultimate human performance, and the number one biohack, breathing and sleep with jaw alignment. If you or someone you know is struggling with TMJ, jaw pain, headaches, neck pain, tension, brain fog, if you're tired, fatigued, use a CPAP. If you snore, you want to get off a CPAP, call us 713-489-6984. You can also email info@alfisurgery.com. And don't forget to share, comment, like, subscribe, and we'll see you here at the Alfi Podcast. Welcome to the Alfi Podcast, episode number 52. We're here with the AOS Miami crew. Dr. Salcines, Dr. Steve Halepas. Welcome to the studio.
Great to be here.
Yeah, thanks for having us.
You guys are not going to want to miss this episode, of course, because we're going to talk about COS, custom orthodontic surgery, the difference between custom jaw surgery, the AOS method, and traditional surgery. We're going to talk about, introduce you guys to these wonderful surgeons that are here full-time in Miami, and get into aesthetic surgery. Dr. Halepas did a fellowship in aesthetics, so we'll talk about that, and adjunctive procedures to custom jaw surgery, things that can be done to even elevate further the aesthetic game. So let's get into it. I want to introduce AJ first. He's a local Miami native, and I'm sure you're happy to be back here.
Yeah, I mean, it's a dream come true to come back. I feel so grateful to be in the community that I grew up in, be back with family. My wife is from Miami, so we both came back home together. Yeah. And it's surreal, left Miami in 2014 after going to the University of Miami, and it's crazy how things come together. Obviously had no idea that I would be a part of this amazing group and this amazing practice coming back, but super grateful that we're all together and we're here getting started back where I'm from.
Yeah, it's awesome. Yeah. A lot of you know AJ from his fellowship at AOS. He was with us for one full year in Houston, did a lot of custom jaw surgeries. You're an expert now. But what a lot of people don't know is that he was a star pitcher for the University of Miami. Star
is a bit of a stretch, but definitely I'm a Hurricane. I bleed orange and green, and I have a lot of pride. And the University of Miami, I feel like, gave me my foundation. I wouldn't be here if I didn't go to the University of Miami. I wouldn't be here if I wasn't didn't learn those life lessons I learned being a college student athlete for 4 years.
You have a pitching record for the school, don't you?
I think it still holds up, and I have the most appearances in the program history as a relief pitcher. I haven't checked the record book recently, but last time I checked, I was up there, which is
awesome. Hang
cool.
on to it.
Yeah, as long as possible.
But yeah. And we're gonna put some flattering pictures of you playing baseball here.
Yeah,
Insert.
We could try to find some.
Yeah. So one thing that I noticed when you were doing your fellowship year is that you were always cool under pressure, and I attribute a lot of that skill to your experiences, on the mound, at a real D1 competitive program.
Like I said, there's 100% a foundation of, being able to stay calm, stay cool, stay collected, work on your breathing. Mm-hmm. At all times, really being able to get to that focus point and not losing it. And that foundation was definitely started during my, really my entire, I feel like the first 22 years of my life were dedicated to playing baseball and really trying to master the craft of pitching. I eventually focused on being a pitcher, but, and then on top of that, I'm really grateful for the places I trained. We all trained in the same program, so kind of come from the same lineage, and we trained in a great place, and I think all that coming together is what really helps all of us, do what we got to do in there.
So for those that don't know, we all trained at Columbia University in New York City, which was really known as a very strong orthognathic surgery program. That's what I was looking for when I was selecting a place for residency.
Same. Yeah.
I remember saying that during my interview.
Right.
Yeah.
And it's incredible looking back how far past that training at Columbia we're at right now. No knock to Columbia.
Yeah.
But it's really true for all orthognathics that's done around the world. The way that we can do it now is completely different.
Yeah, definitely. You're able to kind of, learn so much as you do the surgery more and more, and really just able to evolve so much quicker.
Yeah.
And, I feel like that's what we were able to do in the year we spent together.
Mm-hmm.
From the beginning to the end, we did things differently.
Yeah.
And just continue to improve.
Just learn every day and continue to evolve. That's been something that I've really tried to focus on.
Yeah.
And it's true. We should be better every year.
Yeah. It's something I definitely, I take from that year, and I take from you specifically, is we should never be static.
Yeah.
We got to continue to try to improve, continue to get better.
Yeah, absolutely. I think that's our duty. Dr. Steve, let everybody know where you're from.
Yeah, I live down here in Miami now. I'm from Connecticut originally. I did my dental school at UConn and then residency with at Columbia, and so very excited to be down here. I've been down here for a little bit over a year because I did a fellowship in cosmetic surgery last year down in Coral Gables with an ENT cosmetic surgeon. Did a lot of cases of facelifts, blepharoplasties, rhinoplasties, stuff like that. Which I think can go really well with the type of practice that we have and that we're building down here. I think orthognathic surgery can do so much for your airway, the aesthetic, your facial profile, and then there's some additional procedures that we can do to either help improve the airway some more or help with your profile shape, whether it be a rhinoplasty or some sort of chin augmentation, submental lipo, things like that.
Yeah, definitely. I'm excited about that because it's true. Health and beauty go together, and there's no doubt that making people healthier with better airways, we see these huge aesthetic transformations. Yeah. Right?
I think the biggest thing is if you have someone with obstructive sleep apnea, fixing the obstructive sleep apnea is going to be the best, cosmetic thing you can do to somebody, right? Sleeping better at night, rest, being able to exercise, all of that's going to do way more than a facelift would ever do. But there's definitely stuff that we can do as they continue to get healthier and improve that can help kind of speed everything along.
This is really interesting because I think a lot of facial plastic surgeons, it's very rare that they have what we have with the AOS method, right? Yeah. Experiencing custom jaw surgery where it's now accessible and predictable, but also a focus on airway. Yeah. You'd be surprised how you won't find it in training or in practices. It's almost like it's new information. But to have someone that, to have a practice where we're doing this, and then also you have that experience to add adjunctive procedures, I think is special.
Yeah. I think, our background is unique because when you go and see, a specialist where you come in with a complaint about your septum, they're really only looking at that. They're not looking at the entire track because it's just not something that they were trained to do or just something that they've thought about before. Mm-hmm. And we've already seen, we haven't been open in Miami that long, but in 4 or 5 months, how many people have already tried a septoplasty and they're like, I still have a problem. Or, I've got recently, consults or people call in and they show me they saw somebody and they wanted me to look at their septum. And I'm like, it's true that the septum is not straight, but there's some other stuff going on here that I think is probably going to give you more benefit than addressing that right now.
Yeah, absolutely. I think a lot of the knock that I have on facial plastic surgery is it's camouflaging. Yeah. For the most part, a lot of these issues, right? Yeah. Like chin implants, cheek implants, fillers, neck lift, facelift, rhinoplasty. The way of traditionally looking at these things, you're right. They're just looking at, okay, the nose looks large or there's a hump. Let's fix that. Or the septum's deviated, let's fix that. The turbinates are large, let's get rid of the turbinates. But in reality, most people have a jaw problem, right? We know that just by the proof, if you had your wisdom teeth removed, that your jaws are too small. Otherwise, you'd have room for the wisdom teeth. So it's like proof that everybody has a jaw problem. So all these things that we see like the nose looks too large, the chin is back, the cheek are too small. The solution is not just addressing those individual points, because the real issue is the jaws are small. So when you bring those out, now you're fixing the foundation and fixing the health. But someone like you now has tools to enhance things even further once the foundation is fixed. So.
Yeah. I mean, I think it's something that's overlooked a lot, but like you said, you know, if the top jaw, if your maxilla is too small and your septum can't grow in the correct direction, you know, that's when it starts to grow up or it grows to the side, and then you get your dorsal hump, and, you know, the turbinates don't have space. So they, instead of being, you know, wide like they should, they're tall and they're, you know, taking up the entire area. So, you know, when you remove that bone, you move the maxilla forward, you're making space for them. You know, we might still have to reshape, or we, you know, there's more that we can do, but the underlying problem was the floor, you know? And so you're fixing that foundation. And, you know, if the nasal bone or the septum grew incorrectly up and you still have that, you know, we can still take care of that. But, you know, fixing the base is, I think, essential for the long-term health.
Absolutely. Fix the foundation of the house, make the structure good. Then you start dressing it up with nice paintings and wallpaper and all that.
Yeah, and
stuff.
If the chin was in the wrong position, you know, if you just adjust the nose, you try to make it too small. You know, like I purposely just, you know.
And I've seen that a lot.
And the nose wasn't that small. I mean, maybe it could have helped to bring it a little smaller here, a dorsal hump, whatever. But your procedure, it was too much. You know, because you didn't address the jaws.
Yeah, I agree. If you look at most rhinoplasty practices, and you can go to Instagram and see this for yourself, that most of the rhinoplasty you're seeing, they're all orthognathic cases, meaning the nose looks inappropriately large, or it's poorly supported, so the tip is down, there's a dorsal hump, and they're just correcting these things by making them smaller, straightening out the hump, but they're still retrognathic. Their jaws are still long behind, their chins are behind, their maxillas are shallow, and people are really missing, you know, all the functional things that come with that. And, you know, the same thing with dentistry and oral surgery. It's like, and I did this for a long time with taking out wisdom teeth without thinking, why don't we have room for these wisdom teeth? It's like the jaws are too small. And if you look past the teeth, then it's too small for the throat. It's too small for the nasal components. Yeah. And people are getting sicker from it. So really, really cool perspective now to start treating people in this way. So as we're on the cosmetic topic, can you break down like 5 top now adjunctive lipstick, wallpaper type things that we can add?
Continuing with the rhinoplasty, I mean, you know, I think the key is to not make the tip, you know, smaller, but to add support. And that, you know, that's when you fix the jaws, you don't have to worry about the position of the tip, you know, forward or back. Now we're just adding cartilage to make sure it's strong and make sure the external valve is open so you can breathe. And then moving up in the nose, you know, sometimes as it developed, if there wasn't space, you could have collapse of the internal nasal valve. And even if we address the inferior turbinates during jaw surgery, making space, sometimes that's still collapse, right? Like that was how it developed over time. And that's something else that we can address, you know, with a rhinoplasty. So 2 more things that can help your airway at a higher level after we fixed, you know, a little bit farther down the track, that I think is key in obstructive sleep apnea.
Yeah, I agree. And we see that, you know, a lot of people respond really well, and they can breathe through so much better through their nose because the volume is improved. But there are patients that even though the volume's improved, they can breathe better, that they still have collapse at the nasal valve. And that's a really important procedure that we can add. And
I think that, you know, doing the jaw surgery is almost, I mean, I can't say 100% anything, but 99% of people so much better breathing through their nose, no matter, even if you don't touch the valve, right? Like they're breathing somewhat other, but I think it could just be something else that gets them that last, you know, a couple percentage points that make them, you know, feel like they're back to where they should be.
550 to an AMG 63, and then add the bravest.
It's a good analogy.
To it.
You know, and if we're talking about just general aesthetics, you know, doing segmental lipoplasty in addition to bringing the jaws forward can help to reshape, you know, the neck. And I think if you're, you know, for aging, really treating someone's sleep apnea is going to help them reverse the signs of aging faster than doing any injectable microneedling, facelift, right?
So
I mean, like just breathing better is going to make your skin look better. You're going to look healthier. Bringing your jaws forward is going to help with like the tension, you know, the jowls that have formed on your neck. So, you know, all that stuff I think is really vital to address if you have, sleep apnea, which unfortunately a lot of people do, and it's missed.
Yeah, that's a great point because, the direct is obvious, right? It's like, it's a reverse facelift. We're bringing the jaws forward, it tightens the skin. But the indirect is if you're sleeping better, that's that's the biggest hack. It's the best performance enhancing drug that's available, better than anything on the market, because you get restful sleep and your inflammation is going to go down. Your hormones are going to be regulated. Yeah. You're going to be healthier and your skin's going to look healthier. Your eyes are going to look
I was just about to pick on the eyes.
youthful.
It's like, you can do upper lower blepharoplasty or fat grafting under there to try to help with like the dark circles in your eyes. But if you're sleeping better, it's going to address that probably faster and better than a surgical procedure. Yeah. I mean, if you ever, there's still redundant skin. There's other things we can do, but you're doing a bulk of the work on your own, which only makes surgery easier and actually just gets you a better result.
Yeah, I agree with that. So, but those are good additions. So nasal valve correction, maybe some more rhinoplasty just to, sometimes there's still a little bit of a dorsal hump. Afterwards, it's an easy fix.
You can't, by fixing the jaws may have been the underlying problem, but if they, the nasal bone developed the way it did because it got pushed during, while there was no room for the septum, it's not just going to magically go back, although bringing the jaws is definitely going to help, right? Like you're setting the foundation again.
Yeah, there's still some stuff. Seminal liposuction, especially in an older patient. A lot of our patients are in their 40s, 50s, even 60s as a result of premolar extraction. And they're going to look more youthful, but there is that reality of aging at this point where there's going to be some submental fat distribution.
And if they struggled with, obstructive sleep apnea, difficult to exercise, you put on weight. I mean, that happens to a lot of people.
Yeah, absolutely. So blepharoplasty, even with improvements, there's aging stuff. Yeah. And I feel like a lot of people are motivated after they have the jaw surgery because they're feeling better, right? They're healthier, they're looking better, they're feeling better. And now it's like, oh, I want to do more. Yeah. I look 10 years younger, I want to look 15 years younger. So yeah, absolutely. People are more motivated to do more. Yeah. What am I missing? Any other adjunctive procedures?
Something we've talked about before, but with neuromodulators using Botox for a masseter, both for shaping, that's a big topic cosmetically, but then also, for helping with bruxism and, in conjunction with jaw surgery, can be, helpful for a lot of people.
Yeah, I agree. That's something we've actually been doing since you've left. AJ recently is offering Botox. Like to do it about a month before jaw surgery, just so that they start to weaken the muscle and not have, undesirable clenching afterwards that can complicate healing. I think it's been a good addition.
I think it helps with recovery. It can help with if they already had some sort of pain. It can also just while the airway kind of gets better and all those other problems get better, it can temporarily cause some of the muscle spasming, and then it causes some slimming of the face, which also kind of gives an aesthetic appearance.
Yeah, if done well.
Yeah.
AJ and Steve, both of you have now experienced the AOS method and become masters at it. How would you, you're fresher to the traditional methods and what we learned at Columbia than I am. I've been using the AOS method for a long time, so I take for granted some of the differences, even though I speak about them. But what would you explain, not only to the casual listener out there, but even to dentists and oral surgeons, what they may be missing or not understand?
I think that, being down here, we've heard patients come in that have asked other providers about even double jaw surgery to help them with their sleep apnea. And what they've heard from other providers is that it's a really invasive surgery and they don't recommend it. I think with the AOS method, the easiest way, I think a good way of summing it up is with the AOS method, it's a great option. It's the best option to really improve your airway, to improve your obstructive sleep apnea and hopefully cure it. Even, I think historically, even without the AOS method, double jaw surgery is a great surgical option to treat obstructive sleep apnea. Yeah. With the AOS method, it's a feasible option. Or it's not only the best option, but it's a great option and a very feasible option.
Yeah. Explain what the differences are in
So-
terms of what you see, like why that is. What is the recovery differences? What are the results different?
This with the AOS method using custom plates and custom jaw surgery, the execution of the plan is much more predictable than the traditional way.
Mm-hmm.
So when we plan the case virtually, using our method, we execute that plan, which really allows us to enhance the airway the way we wanted to.
Mm-hmm.
When otherwise, sometimes you plan these movements of the upper jaw and lower jaw, and you don't necessarily achieve them.
Mm-hmm.
And then you didn't augment the airway as much as you really wanted
Hoped
to.
for.
You and I, Dr. Alfi, we were averaging 50-minute double jaws, in Houston.
Mm-hmm.
And when that's the surgical time, the recovery is so much better for the patients. So much less swelling, so much less trauma. 99% of the patients are out of the hospital in one night, and they're feeling good the next day.
Is that not the case with the traditional method?
Yeah, with the traditional method, we saw a lot more swelling, a lot more discomfort.
I think we take for granted that we trained, at Columbia, where when AJ and I started as interns, everything was still, traditional plates, bending them. But the surgery was still done relatively, quickly because we did a lot of them. But we were there as we started doing custom plates. We started doing, cutting guides, and by our chief year, we were doing it for every case. And then obviously, bringing on the piezo and, using more technology. But we saw that progression in our residency program, but I don't think that has gone everywhere else. So we remember what the old way was, and we remember, if you don't have the system, a procedure that could take 6 or 8 hours, and then the recovery, how swollen they are the next day, kind of how miserable they are, and how many nights they might have to spend in the in the hospital, versus now, if you're already starting recovery that morning at 10 a.m., by the next day you're like a whole new person, rather than when you finish the case at 9 p.m. and then difference. Then you were in there all day under general anesthesia getting fluids, and custom plates has really revolutionized, I think, this procedure. And I don't think word has spread enough. At least we haven't even seen it down here, right? Where other specialists know that double jaw surgery is an option, and that it's a great option for a lot of people with sleep apnea. Yeah.
What do you say to, now that you guys are proficient in the custom workflows, what do you say to the critics of it that custom doesn't work, first of all? Or it's not better?
Yeah, I think it's definitely better in our hands. I would not want to do a case not custom. I think our results kind of show that we can execute these movements reliably and get the results we're looking for because of our ability to use custom plates.
Yeah, we've talked about this before, but in your lecture of history of how you were trained, and moving the jaw forward 4 and bringing the mandible back 4, prior to thinking about the airway, I think the paper might have been on MSGen, I can't remember exactly, but only can be accurate to 2 millimeters. So if you're coming forward 4 without custom, you could end up at 2, you could end up at 6, So it's like, and that was the best we could do, and that was thought to be great at the time, with custom, with traditional plates. So I think, now that we have, this technology, and we can be accurate under a millimeter, we're actually getting the movements that we planned.
That you planned,
and it's like, it's hard to think about doing it without it.
Yeah, I think that's what people don't realize, especially for surgeons that haven't become proficient with custom or tried it enough, is that they don't realize how much fudge factor, because I didn't realize it when I trained with the traditional methods until I became proficient and really understood the custom workflows. It was like, oh wow, we were fudging a lot, because there was no way to confirm your position.
Yeah.
Because with the traditional, it's the same thing. It's titanium plates, so it's not like the materials are any different, right? But what the custom plates, guides and plates tell you is in the operating room, if the holes match up perfectly with the plates, you know you're there, right? If you don't have those custom plates, you're using the information of just wiring teeth together and then bending the plates to bone. You don't have that reference to know that you're a millimeter shy, 2 millimeters shy, even 4 millimeters shy, because you can bend the plate to the bone as long as you're holding the bite together.
Right.
And I think that, we are using custom plates, you gain an appreciation. This is a bit technical, but you gain an appreciation for that soft tissue envelope and how much resistance it really applies to the movement. Point. Like you can't appreciate the soft tissue during surgery, especially in the mandible,
especially with airway movements.
In an airway case, all of our cases are airway cases.
Right.
But that soft tissue envelope really applies a substantial amount of resistance, and really you got to overcome that to get the executed plan. And the only way you're getting that, or that custom plate information tells you if you're there or not.
Correct. Yeah, that's a great point. Otherwise, you never battled that. You take it. Just because when you use your splints without custom cases that the teeth are together, even your intermediate splint, again, it's a little technical, but you don't know where the bones are. You don't know where the bones are, and the teeth are far from where you're plating, right? So there's rotation. Your teeth might be lined up. But you may be rotated like this. You may be high, you may be low. There's no way to know that.
And it's hard to understand until you see it with a custom plate. Like you don't have an appreciation for it.
You don't have that appreciation for it.
Because you would think you don't think it would be the case, like you have your intermediate splint.
And that's all you know at this point.
Yeah.
When we first started doing custom, especially in the mandible, I remember AJ and I talking about it, we hated the custom plate in the mandible. We were like, there's something wrong. It doesn't work. But
that's what I hear all the time.
Yeah. And
people like to do it for the top, but they're like, it doesn't work for the bottom.
It's like, we used to say it didn't work. And we were like, why doesn't it work? And if the thinking about the condyle can move in so many more directions. It's like you weren't appreciating that when you're bending it a plate by hand, that you're pushing it in a different direction because it can go everywhere and you don't even know. So the reason it wasn't lining up is because you didn't dissect enough of the envelope.
Correct.
You didn't let it
remove interferences.
It wasn't passive, but we're like, it doesn't work. It's the plate.
Yeah. Beyond even the forward movement is what you're doing to the condyle.
Yeah, and there's no way to know what's happening there, which is why, everything we've learned about traditional jaw surgery is that the TMJs are going to get worse or can get worse. But the reason for that is because there's no way to account for rotations or bad rotations. Right. Of the joint itself, because you're not seeing it.
Yeah.
But if you use custom, if you know how to use custom the right way, there's a learning curve to it, which is why we're seeing people not comfortable using them on the lower jaw. But once you learn how to do it, and obviously you guys know how to do this now, you realize that you can control a healthy neutral position of that joint. And now what we're seeing, or doing 200 plus cases a year, is that the joints get better. They don't get worse.
Yeah.
I think another good way of kind of explaining it is, whenever we plan a jaw surgery, we're putting that joint in a healthy position.
Yep.
But using the custom plates, we know that joint is in the healthy position we put it in.
That you planned. Yeah.
So we really execute it, that part of the case as well.
Yeah.
I think that's another reason why, orthodontic surgery could be a great option for somebody with that TMD that's kind of unexplained. If, they might have some sleep apnea, on the sleep study, they have that TMD pain, they have some asymmetry. You're like, the red flags go up that this could help you. Something is resetting the joint position, resetting, airway, all getting better sleep. The body could be posturing, or, it trying to open and close kind of in an asymmetric way, or all signs that something is, even if there's nothing wrong with the joint, on our imaging now, it's in the future, there is something going on because of everything else.
That's a great point. I'm going to expand on that, because this is something that really, until custom became an option, this wasn't really a discussion.
Yeah.
And it really changes what we know about TMJ issues, because you're right. If you have asymmetry in the jaws, so one side's shorter than the other, make an equivalent to having one leg longer than the other. What's going to happen to the hips, and the back and the spine, right? It's like the pressure and functional strain on the asymmetry is going to wreak havoc on.
I thought about the exact
On this,
analogy recently.
right?
And I was like, and you think about putting a brace on your hip is not solving the problem. Like wearing a night guard. I mean, night guards can be very helpful. I'm not, but that's not going to solve the problem that your legs are not the same length.
Exactly.
Yeah.
Exactly. So then that havoc is still going to continue. And it can continue, if you solve it temporarily in the joint itself, it'll continue on the spine. It'll continue on your back or your shoulders or even down to your feet. But at some point, that functional constraint or strain is going to present itself. But now we can fix those asymmetries, make them healthier.
Yeah.
And that's just a very specific mechanical example, but it goes beyond that. Right. It goes into function too, because if your airway is small, which probably 90% of the population, their airway is small, and I think I'm being conservative with that number. If you've had your wisdom teeth out, your airway is small. That's just a fact, right? Smaller than it should be. So what you're going to do is you're going to compensate at night, clench your teeth. People call it bruxism. And now you have small jaws. The mechanics are not perfect. You're hyper-functioning on these things. What's that going to do to the joints itself?
Wear and tear.
Exactly.
Wear and tear, right? And if you address the joint, let's say with a total joint replacement, but you don't address the functional issues, where's that strain going to go, right? It's going to go on the screws and the plates of that custom joint. Or even if it's strong enough, again, it's going to transfer to other parts of the body.
Yeah.
But that TMJ conversation, it's still so new because most people are not experiencing how to use those custom plates on the jaw. So it's kind of you may be on an island for a while
and I think,
discussing this.
And I think by, not saying that you're doing surgery on the joint, people don't feel like you're treating the right thing.
Yes.
But I think that, it goes back to the underlying problem, like just like not doing the rhinoplasty maybe first, or maybe doing it with a jaw surgery. It's like you're skipping a step, but people only feel that you're addressing something by actually targeting the joint, but it might not be the joint itself, and often isn't. But there is a real treatment that can still be helpful.
Yeah, I agree. It's always airway first. In my opinion. The mechanics of it, for sure. And most of these people have malocclusions. Right? So they have bad bites.
Or asymmetry that was corrected with ortho, that their bite may look good, but it's still, there's a cant. They're like, the joint is not happy.
Yeah, totally.
But their teeth are straight.
Most of the orthodontic community, like if you go into an orthodontic office in your neighborhood, 9 times out of 10, the orthodontist is going to focus on straightening the teeth. Right? Similarly to if you walk into a plastic surgeon's office, 9 times out of 10, they're going to just try to address the nose. If the nose looks inappropriate. Right? The teeth are really the gateway for all this breath. And I think it's a huge mistake that the orthodontic community is missing, is that they're just trying to straighten teeth, not realizing that the jaws are too small for these teeth in the first place.
I think for a lot of orthodontists, it's got to be difficult to kind of bring up that conversation. And I think that's why this is so important, is to get people in general talking about asking, be like, what do you think about my air? Have we thought about that as a concern rather than, because most people, when they do go in for orthodontic, they're not expecting anyone to talk about surgery, right? They're thinking they're going to get their braces or Invisalign and kind of go. So it can be a hard conversation maybe to have, but I think us talking about it and more people talking about it can kind of change that. And it also, I think, highlights how important it is, if you have any signs of sleep apnea or airway, you should get a sleep study. How, like 100%. Just information. Just don't have to do necessarily anything with it.
And back to AJ's point earlier, is that the experience of a lot of these providers, like you said, you came to Miami and everyone's concept of jaw surgery is, horrific. Right? So the last thing they want to do is even think about discussing that with their patients. And I've heard this from friends that are orthodontists a lot. But it is about getting this information that we're talking about almost a different procedure.
I mean, I think, one of my goals, or one of our goals as a practice, is to make this surgery accessible to everyone down here, and really make it an option for people. And, an option for our orthodontist to present as a viable plan to a patient.
Absolutely.
And us to, we're happy to guide, help, coach, anyone through the process and again, help people do this.
Yeah. And you guys are here full time. Available.
And one of my goals that I've thought about was, being able to offer everything for the airway and everything, for the facial aesthetic in terms of getting people the result that they're looking for.
Yeah.
And I think that our practice offers that.
Yeah. Actually, it's in the name. What does AOS stand for?
Airway, aesthetic, and orofacial surgery.
Yeah. Mm-hmm. So it goes with that. Sleep studies.
Oh, sleep studies. Yeah.
Yeah. We can do more sleep studies.
We should. I mean, we want to.
Yeah, we got to do a lot more sleep. We should all get sleep studies.
I want one.
Yeah. So I wanted to go deeper into that because it's really that simple. Like if you've had your wisdom teeth out, if you've had crowded teeth, if you needed premolars removed,
if you had expansion,
it's like everyone's just looking at the teeth.
Yeah.
Right. But
if you have jaw pain,
right? And how many of the population fits into any of those buckets?
Large.
Yeah. Probably everybody listening.
Yeah.
Right now, like if you're listening and you haven't had crowded teeth and needed braces, if you haven't had impacted teeth and needed them removed, like your wisdom teeth or more, if you don't have, clenching, jaw pain, clicking, all these things, just put a thumbs up on a comment. I want to know who you are.
Very fortunate.
Yeah, very fortunate. We want you working our front desk.
Yeah.
But the reality is that probably all of you listening right now fall into that category. And that means that it's more than the teeth. Like we said before, there's your nose, which sits on the upper jaw. There is the tongue, the throat, which is the barrier of air into the lungs and out. So it is that simple of a concept. If you don't have room for your teeth, and means your jaws are small, it also means they're small for your throat.
Yeah.
And every one of these people, first and foremost, should be testing their sleep before anything, because it's the foundation of health.
And it's become so much easier to do, at-home sleep tests. It's really no reason not to.
Yeah, that's a great point, because when I started doing this, I would advise against home sleep tests. We would be like, you have to get an in-lab sleep test because the home ones weren't accurate enough. But it's not very convenient to go to a clinic and sleep and try to get good sleep there with a bunch of wires and monitors on you. So I can understand the barrier of that. But now, even in the last couple of years, maybe even in the last year, we've been doing more home studies.
The technology is getting better.
The technology is so much better.
Yeah.
Mm-hmm.
And all you have to do is wear a ring. You don't have to wear any monitors. These companies will send it to your house. It's affordable. And you just sleep with a ring for 2 weeks. A doctor will read a report.
Yeah.
And it's as simple as that. And I think that, we sleep a third of our life. We should. We don't, but we should, right? We're supposed to, out of 24 hours, 8 hours of it should be asleep, which just goes to demonstrate how significantly important it is to sleep well. But we just don't do it. And we can't, and most people can't do it because of this jaw size problem. But it's so foundational for all of health, right? We know that. We know that for mood, psychiatric conditions, focusing.
So many great results from, we see so much improvement in all those areas on so many patients.
We see it all the time.
Yeah,
we see it all the time. And then physiological, we see people come off blood pressure medications. We see them come off autoimmune medications, immunologic medications, and they have these conditions like lupus and rheumatoid arthritis and Pott's disease. And how many times do we see those things disappear after
numerous
surgery?
times, and I'd never seen that before until I spent 8 years in Houston with you. So it's not something that
it's not commonly known.
Commonly known, talked about, thought about. But it happened.
If you don't know how to get a sleep study, just contact.
Yeah.
Call the office.
Call the office. We'll help you out.
Yeah.
But I think at foundational, before having any diagnosis, right? Like before accepting a diagnosis of ADHD, anxiety, depression, high blood pressure, autoimmune condition, you know, there's so many diagnoses out there, POTS.
Yeah.
It's like, first, do you have a sleep and breathing problem?
Yeah.
First and foremost.
Right.
But the reality is nobody's doing that
Right.
first step.
You know, there's a path to augmenting your sleep, which will have a domino effect on your overall health.
Mm-hmm. Yeah.
And you can do it at home. There's, I mean, no risk to wearing this device. You know,
Yeah.
it's just information, right? Like, I mean, we're doing it with our Apple Watches or, you know, certain.
Yeah,
you know,
I got my
your
Oura Ring.
Yeah. But this is like, you know, medical grade information that you can get right away,
Yeah,
you know?
I agree. Yeah, myofunctional therapy. Let's talk about that.
Okay.
Because was that when I was at Columbia training, I never heard of a myofunctional therapist. You guys are closer to training at Columbia. Did that term ever come up?
No, I don't think that we were connected in any way to that.
Outside of maybe like a cleft kid, you know?
Right, at the Children's
Yeah,
Hospital,
that's probably
Yeah.
the extent of our,
Yeah.
but not routine.
no.
No, not yeah, and you know it's very important. You know, we see it all the time, and you know how much that myofunctional therapy before and after surgery really allows everything to settle nicely and get that optimal result from the surgery.
Yeah, absolutely.
Yeah.
And we have a lot of great myofunctional therapists in Houston from doing so many surgeries there. There's not a case that I won't recommend a myofunctional therapist for. It's almost mandatory in our practice now. Obviously, it is here in Miami too. So if you're a myofunctional therapist or you know one in South Florida, just reach out to us because we need more providers to help our patients.
Like like the hostage tape or mat, you know, and with the myofunctional, you know, like how I think even after surgery, kind of helping the train, and that also could be an indication of doing a rhinoplasty after, right? If you're forcing through the nose, but you're still having a problem.
That's a great point.
Not down here.
That's a great point because really, what hostage tape and these for the nose or the mouth, right?
Yeah.
Like they have nasal strips. The nasal strips in particular, and what they're doing is they're opening up
The valve.
a collapsed valve.
Yeah.
Which
we can do permanently with cartilage, you know,
Yeah.
with surgery. It's kind of like not a Band-Aid.
Right. Yeah. So I definitely like nasal strips for all patients, especially after surgery.
Yeah.
So that's a nice hack if you're planning to have surgery anywhere. Get some nasal strips because even directly after surgery with all that congestion, it's going to help you breathe through your nose. And really, such an important, you know, facet of all of this is to eliminate mouth breathing.
Right.
Because mouth breathing is so detrimental to your health and learn how to nasal breathe. The reality is that most people are not good nasal breathers.
Right.
Because of the way the jaws have developed. So now that we're fixing this, trying to train yourself to become a nasal breathing takes some work. And I don't think a lot of people appreciate that it does take work.
Yeah.
But nasal strips do help.
I mean, you have to retrain how many years of your body trying to breathe through its mouth, and now, you know, breathing through the nose just kind of will feel like a foreign concept. And even if you fixed what the reason was that you weren't doing it to begin with.
Yeah, exactly. And I think that, you know, if we can put a diagram up here of nasal and facial musculature, right?
Yeah.
Like the nasalis muscles, the zygomaticus major, minor, all the perinasal muscles. There's a lot of muscles.
Yeah.
And they're small. And it's hard to appreciate that if you're not a nasal breather, you're going to be weak in the muscles that are important for nasal breathing, right? So if you can just think about your bicep for a second, and if you don't use your bicep, you're not going to look like you guys. You're going to have weak-looking biceps. But if you use your biceps, it hypertrophies, it grows, it's able to pick up more things.
Yeah.
The perinasal musculature is no different, right? If you're not using it to breathe, and then all of a sudden you want it to breathe, it's just not going to have, as simple as that, the musculature to do it.
Yeah.
Right. So it does take work. And I think that consciously training it during the day is so important. You got to get your tongue up on the roof of the mouth to do that.
Right.
And myofunctional therapists are excellent in training these things. And then during sleep, it's going to take some time to get these muscles working right. But I do think an aid like a nasal strip is important for that.
Yeah. I mean, I think a nasal strip even beyond post surgery, if you're finding that it helps you, and you, especially for someone who's had jaw surgery months down the line, that could be, something that we could help address with a permanent fix if it is something that, without it, a year, a couple of years after jaw surgery, that you're still, even with the soft tissue, you're still kind of collapsing, that we can do something to help augment that permanently.
Right, and help that.
I feel like we've met a lot of great, providers down here. There is a lot of focus on airway. We're happy, we're looking for people to work with. We want to work with everybody. Want to be accessible to everyone down here.
Yeah.
Happy to speak to anyone who wants to reach out. We're looking for people to connect with.
Yeah.
And continue making connections that we've already made.
Yeah. So we're here in South Florida. You guys are here full time. So any providers out there that want to learn more about airway and want to build an airway team, reach out.
Yeah.
Reach out. We're available.
We've met so many great people already in the area and the community, and they all seem very excited to talk about this topic because I think everyone's starting to notice, in the dental profession especially, that there's more that we can do.
Starting to see a trend.
Yeah.
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 It's awesome because it's way different than several years ago.
Yeah.
Yeah.
I felt like I was on an island for a long time.
And Houston is like such a,
We're
I
way
feel
ahead.
like Houston is a decade ahead.
I really think so.
I've been in our training. We were in New York, we were in Boston. I was able to spend a year in Houston, and like this whole, the airway movement down in Houston is really, it's
way ahead.
Way ahead, way different.
I haven't lived in Houston, but, knowing from you guys, when we lived in New York, I think jaw surgery, even if it wasn't done the same way, it was still very accessible. There's probably because there's like 14 residency programs and there's all doing jaw surgery.
A lot of programs you can do it in.
I think down here, it's not necessarily the same. And so I think us being here, we're back to AJ's point, like trying to make this available. Yeah. And I think that's our, a fundamental goal here.
And I think it's going to make a huge difference. I think a year from now, what is the date of this podcast? Or is it the 21st?
21st.
2025. I think that my prediction is a year from now, because of you guys, that Miami's going to be a hub for airway. Just because it's an option now.
I hope so. For sure.
Yeah. That's definitely that's our goal.
Yeah, I really think so. When you were on the mound, first of all, take me through the most stressful pitching moment of your career at Miami. Just one moment. Give us the picture. Paint the picture.
Oh man, there were a couple. They're great. I was able to pitch in some critical moments.
Paint the picture, like time of day, score.
Time of day. So
who you were up against?
I think we had won on Friday and lost on Saturday. So the series came down to the Sunday game. There's always a great crowd at Florida State, especially when we go up to Tallahassee.
Is that a rivalry?
Yeah, FSU Miami is a big rivalry. It was a good game on Sunday. We were tied in the bottom of the ninth. I was pitching.
Are you a relief pitcher at this?
Yeah, I was a relief pitcher.
Yeah.
We were tied in the bottom of the ninth. I think it was a man on first and second with 2 outs. That runner on second scores, we lose. Go home, lose the series, lose the game. It's a long ride home from Tallahassee when you lose on Sunday, especially when you're the.
It's all on your shoulders.
Especially when you're the pitcher who gives up the walk-off hit or run. An unbelievable moment. They, like I said, they packed the house. I don't know, 10,000 people there screaming at me.
So you have someone on first and second.
Someone on first and second.
Outs?
2 outs.
2 outs. So
Bottom
all
of the
pressure's
ninth.
on.
Yeah, pressure's on. And
what's the score?
3-3, 4-4.
Yeah.
Something like that. I don't remember who was hitting, but get him on 2 strikes. I think I ended up with a full count and was able to, strike him out with a good slider. And I thought that was like one of the better, more stressful moments. I remember being able to hear everyone, and then in that moment of being in the game, you kind of get that tunnel vision that you hear a lot of people talk about.
Yeah, you just filter everything out.
And, I think the great athletes do it all the time.
Yeah. when they can get into that zone.
When they can get into that zone.
Yeah.
And I felt lucky that in that moment it happened to me.
You felt it.
Without even thinking about it. It just
Right.
happened, which was looking back on it, there aren't many times in your life where you get an opportunity to really do that.
Yeah.
So I feel very lucky to have had that opportunity. And, thankfully I got us out of that inning.
Are you doing anything, consciously at the moment, like breathing to get into that zone, or are you just... Everything's just in the moment.
It's like you don't even think about it. It's like, it's hard to explain.
Yeah.
And I think that's what most people say. That's what I've heard people say. It's hard to explain. But the ones who are, the greatest athletes,
get there all the time.
They're always there.
Yeah.
I imagine.
Yeah, I imagine that too. I mean, I played basketball in high school.
Yeah.
And, I think anybody that's played sports they've been in the zone at least once in their experience, right?
Yeah.
Like anyone that's played basketball for sure, when you're on fire, that you're in the zone.
Yeah.
Like the basket looks huge and you just know that you're going to throw it up. Doesn't matter who's defending, it's going to go in. And I remember getting there in high school several times, and it's such an amazing feeling because you really see the game differently and you feel like you're not going to miss. Now, what's interesting is I feel that in surgery.
Yeah.
And I recognize it, and sometimes it's like my hands are moving more fluid, the sutures are going.
We're doing cases, and we're like, when it starts and ends.
It starts and ends, yeah, and you're in the zone.
And it's over.
And as much as I wish I could have been a professional basketball player because I love basketball so much, or played D1 like you played. It was those moments in the zone that were so awesome to be in, and I feel blessed that as a surgeon that I could experience that.
Yeah, it's the closest. It's definitely the closest thing to it for sure.
Yeah,
it's equivalent.
It is, right? Because you felt both.
Yeah, it's equivalent. Nobody's yelling at you while you're doing surgery, which is nice.
Well,
10,000 people aren't yelling at you.
Depends where you're at. It depends who your nurses are.
Yeah. But it's you get that zone is special and fun.
It is fun.
Yeah.
That is cool.
Yeah. Felt it a lot more in Houston than I did previously.
Get in the zone. You need some good teammates.
Yeah. Yeah, it takes teamwork
to help get you there. Yeah, I do feel like your experience as a pitcher definitely translates to the operating room, because I felt like you were never frustrated or put off path.
Yeah.
Even in a clinic with some patients that could be frustrating, difficult, you're always calm and cool.
Thank you, I appreciate that.
And I always thought, that connection between sports. I always, I have 3 kids and I love sports because I think you learn so much real life skill that you're going to apply, like in this instance in surgery. But I can directly correlate like your experience on the mound, taking all the heat for a team like you just described, and what that means to become a surgeon and use those skills. And
then I think another real something that really translates, and something that I would use while I was pitching to make me feel like I'm in control. It's nothing happens until I decide something happens when I'm on the mound, right? Like nothing's going to happen until I make this pitch. Like I'm in control of the moment. And the same thing in surgery, right? Nothing's going to happen until we decide it's going to happen. Like we are in all the control. And it's a good thing.
Yeah.
We want
to recognize that you have.
Like this is everything is in our control, and it's a good thing. And that's, how, it's up to us to execute everything, and we can do it.
Yeah. It's awesome.
Yeah.
We're going to wrap up because we're out of time, but AOS Miami is alive. We're here.
We're here.
Yeah.
Full time.
Yep.
Here to make amazing results for amazing people and give them amazing airways.
Yep.
These amazing doctors. Yeah. So
super excited.
You know how we end all these podcasts. Greatest basketball player of all time. AJ?
Kobe.
Yes.
Trying to think. I guess Michael Jordan.
Yeah, there we go.
Yeah.
I feel like I can't
my top two.
You could.
My top 2.
Yeah.
I'm going to say Kobe.
Yeah.
Yeah. I love pearls. Favorite biohack?
Can we just all pick jaw surgery?
Yeah.
Yeah. Jaw surgery.
Jaw surgery.
Custom orthognathic surgery. COS. All right. We'll see you guys next time.
Thank you.
Thank you.